Good morning, Nancy, one of the care queens with the Hospice Care Plan and Ode Not a Care. I'm often asked what type of tabbed or adult briefs that I should buy. And I would like to first of all say that the transition from wearing a regular adult underpant, male or female, to then an absorbent pull-up type of underpant, and then to an actual tabbed brief. We don't call them diapers because we find that that's really demeaning, so we use the word brief even though they do look like a diaper. So that transition is often quite stressful. But in the meantime, let's go back to the functionality of it. When you choose a pull-up absorbent brief, make sure that it is snug but not overly tight. The elastic in some of these briefs can really cause even bed sores, erosion in the groin area. So always check that when you are changing a brief for one of your clients or family members, and make sure it's not too tight. When you transition then to with a client, a patient who can no longer stand, so that you can take a brief off and pull one up, an underpant type, it is time to move to the tabbed type of a brief, again, looking like a child's diaper, only of course adult size. You want to choose one that has the tabs that can be almost used like Velcro, so that they open and close. Please always err on a larger size, and then you can always back down, but err on a larger size. For some people who drink a lot and urinate frequently, you might want to add an additional layer of absorbency. You can get the inside pads, which look like our old-fashioned, I'm going to use the brand name Kotex pads. They actually have sticky surface on them and can be put on the inside of either a pull-up or a tabbed brief to add an additional layer of absorbency. Now, the reason I'm a little hesitant to even say that is because then what happens is people wait way too long to change the brief. The patient has been sitting in a saturated, very heavy brief, and the fluid is against, the urine is against the skin too long. And it's better to change more frequently, and hopefully you are checking your clients every 4 hours to see if they need a change. Even though these briefs are highly absorbent, the pressure on the skin, the fluid on the skin, whether it's stool or urine, can be very caustic and cause the beginning of bed sores. So please do use the appropriate size. Be supportive of your loved one or client when they need to change from one or to the other, and allow them to make the choice as long as possible. If you are unable to have them stand and be able to clean them appropriately, it is time to go to a tabbed brief. Any brand that works for you is appropriate. You might even go to your local hospice or a facility, see what they're using, and try those brands. Generally, they are ones that have been tested and are very easy to use. Thank you, and best wishes for you. It's one of the biggest chores in taking care of a patient. It's also one of the most tender and important gifts of care that we give to any human being. Thank you. Please don't hesitate to go to our website, thecareplan.net, for our booklet, lots more information about end-of-life needs, and our YouTube site, thecareplan.net, YouTube, The Care Plan.